Hello, everyone. It's Karissa from Shining Light on Minnesota. I'm very excited. We have Paul Long with us today. Welcome, Paul.
Hi, Karissa. Nice to be here. Thank you for having me.
You bet. So let's get started. Tell our guests a little bit about your past in the medical world and kind of what got you here today to Shining Light on Minnesota.
Oh, sure. I again just appreciate being here, and I like how you enjoy talking with people from around Minnesota, and just to like to hear stories. My story in healthcare started really when I was in the airline industry, and learned a lot about digital health, being digital anyway. So I was part of the team that built the first ever booking engine for Northwest Airlines, and learned a lot about the digital space and helping customers kind of navigate that journey around finding their flight and finding their travel. If you translate that to healthcare, people are on a journey all the time as they navigate their own healthcare journey, and no journey is the same. Having worked in the airline industry and then in loyalty marketing, and really understanding what it took to make customers sticky toward a product or a brand. All of that led me to really trying to understand what is the experience that members are having, or customers or patients are having in their own healthcare journey. In about 2012, I made a big shift. I actually was a company owner. I owned a loyalty marketing company, and I said, I really want to go to a place that will focus on the end-to-end consumer experience of something really big. Now, that can be a lot of different organizations, but the industry that I chose was healthcare.
Yeah.
And it's been very fulfilling, and at the same time, it's a big, big challenge because we have a lot of challenges in healthcare as we try to make it better for everyone.
Yes.
And make it just simple to use, and lower the cost.
Well, and it's interesting because no matter where you go, it's always the needs of the patients and the needs of the care, and all is the needs of everybody, right? So how you get there and how you navigate through it is very interesting.
Right.
Yes.
Yeah. My own journey in healthcare really has been through my mom and dad, who recently passed away. My dad passed away in 2019, and my mom went to be with him in 2022. But being a caregiver of elderly parents is the way that I've really experienced the healthcare system. I'm a pretty healthy guy, and my family has been healthy, but helping my parents navigate their later years in life has been really my journey. And the journey is challenging, especially for older adults, where they're taking multiple prescriptions. Today, Karissa, 74% of people in the United States, adults in the United States, have at least one chronic condition.
Right.
That's what we are dealing with.
Right.
And so that's something that just drives me, because I don't think that we should be having 3/4 of our population in chronic conditions. But when we do, how are we taking care of them?
Right.
And how are we helping them to get healthy?
And it's only one. You look at, I have one parent that's passed away and another one that's ill, and you look at their list of prescriptions and you look at their list of chronic conditions, and it's multiple. There's lots of them there. And you think of what are the steps that you took to get there? And let's look at your lifespan and the care that you had getting to those stages. And what were you missing throughout that lifespan too, right? What did you do? What did you miss? And how can I better myself to get there too, right?
That's right.
Yeah.
Yeah. And even as and we can look back, and at the same time, what is happening with them right now?
Right.
Those multiple medications, as an example, in the work that I've done around consumer experience, we would go into some of our members' homes
Yeah.
and just look at, kind of like, well, how are they kind of like, managing their day-to-day life?
Yes.
I used to deliver Meals on Wheels with my dad. And when you walk into a house that may not have electricity, or they're living in squalor,
Yeah.
or they have multiple pets that are, they're not taken care of. They're not
Feces
going out.
everywhere,
They're
whatever,
not
yeah.
going
Yep.
outside. And then you're looking at, well, how are they taking their medication?
Are they
They're
taking their
often, or are
medication?
they, or
Right,
are they
yeah.
taking their medication?
Yep.
And if they are, what we've seen in the past is they're literally pouring all the medication in a bowl,
Right. Yep.
and they're just sort of
And they all
taking a
look the
little
same. They all-
handful,
yep.
and they're saying, well, I'm hoping for the best, that
Right.
these are the medications that I'm supposed
Well,
to be
they all
taking
look the
today.
same. The numbers are the same. They're all white. They're all green. They're all yellow. Whatever colors they may be, they all look identical. And even with the pill counters, you can't see day to day what you've taken, what you haven't taken. I mean, it's hard enough for the care of a parent to know enough to get up through the day, what time you're getting up. Did I take my pills? Did I not take my pills? Nonetheless, did I shower through the day? Did I eat my food?
That's right.
Am I not eating my food? I mean, I'm going through that with one of my parents, kind of enough information there, but it's a lot to even see if they're taking care of themselves through the day. Nonetheless, are you taking your pills? Is the care there? You know, are you taking care of yourself in your own home? What's the next stage look like?
That's right. Yeah.
So it's interesting.
Yeah. And I think that when I joined a company in town back in 2012, it was just starting where the government was taking a more active role in helping members get the care that they need.
Yeah.
The industry itself has, I think, come a long way to try to understand, well, how much does healthcare actually cost,
Right.
and how do we lower the cost of care?
Right.
So there's a whole sort of pillar around lowering the cost of care.
Yes.
There's a whole pillar around making sure that the care that members and patients get deliver good health outcomes.
Right.
Because there's a lot of things that we do, it's sort of like busy work at
Oh,
work, right?
absolutely,
Like
yeah.
it's busy work, but it's not really having the outcome that you want it to be, right?
Right.
So are the patients getting the right outcomes for the
Yes.
care that they need? Are they getting the right access to care?
Correct.
So access to care is another pillar, a third pillar. And then the last one is, are we delivering a good experience?
Yes.
Now, in my perspective, I actually think that that experience that members or patients have in their healthcare experience is the thread
Yes.
that delivers better outcomes, makes sure that we give them the right access to care, and will lower the cost of care. Because if they're having a good experience, they're more likely to perhaps get their preventative exams when they need them. They're more likely to better understand how to take their medication. And so ultimately, they're going to live a healthier life.
Correct.
And so that's really just been my goal in this whole thing, as being a chief experience officer, is to focus on what is that experience that members or patients are having, and how can we make it better? And so what that requires is, man, do we have the right technology?
Right.
Do we have the right people in place to help? And then what are the processes? So I always try to look through the lens of the person who is dealing with whatever experience that they're
values
dealing, whatever it is, whatever moments whatever moments that they're having throughout any sort of a journey. And then how do we make them better? What are the processes, the people, and the technology to make those things better?
How has the experience changed in the last the last 5 to 10 years? Obviously, it's changed quite a bit in your eyes, and it will continue to change.
Yeah.
But what have the processes changed, and how do you think it's going to change in the future?
Yeah, well, good question.
Right.
Yeah, I love that question. Thank you. So I think, first of all, if you take something like the Affordable Care Act, the Affordable Care Act was something that was implemented kind of right around 2011, 2012. I think it was ultimately enacted in 2014. Now, there's you can have an opinion one way or another
Right.
of the Affordable Care Act, but one of the things that it's doing is it's causing us to think about, wow, do you even know how much healthcare costs as a person yourself? And so if we can start to sort of use the framework of the Affordable Care Act for new products, like a new product that it's currently on the market is called ICRA.
Yep.
And that stands for Individual Coverage Health Reimbursement Arrangement. And many employers now are considering, instead of delivering or giving health care to their employees, they're suggesting, why don't I just give my employees money and they can go out on the open market
And
shop around and get the right plan for them? Because as a healthy person, I don't necessarily need a gold plan in which everything is paid for, but I could use the excess dollars to get, for example, better eye care, or I could get, my dental care. If I need a gold plan, I'm still getting money to go out in the open market. So I consider that a very consumery plan.
Yep.
I think it's great for employers as well, because it's a defined contribution that they're giving to members, or to their employees, and then what that allows for is the employers then have a better understanding of how to budget.
Correct.
This next year, we're all going to see some pretty significant rate increases in our overall health insurance. And so by thinking about ICRA as an example, it puts the responsibility in a good way on the person to get the right health care that they want. So that's like one example.
Right.
On the health services side, I'm seeing a lot of navigation companies. So helping people navigate to the right care that they need at a lower cost, at faster service, and getting better outcomes as a result.
Right.
For example, let's say that I'm thinking about getting a knee replacement. I can use a care navigation company to find perhaps a closer doctor for me at a better cost, or maybe it's farther away, but they'll pay for
network.
It's still in network, and they'll pay for my my flight or my travel to get to that doctor to get the procedure that I want at a lower cost.
Yep.
And so those are two, I think, really important things that are getting more widespread acceptance that I think will ultimately improve the experience as well as outcomes, costs, and access.
Which is important. You've got to have that. And people don't understand that sometimes healthcare isn't always, let's go to the highest plan and get what we need, bang for the dollar. Because especially within the next year, you're getting older, rates are going to go up, things are changing in the economy, things are changing everywhere. You've got to go where it's going to make sense the most.
That's right.
Yeah.
That's right. And with a health savings account, another example
HSA,
of a really, really good product that's part of healthcare is that you can take those funds, and if you're not using them, you get to keep them in a health savings account. Some accounts don't allow you to, but a health savings account does, and you can actually turn that into an investment. You can actually invest those dollars, and so that when you do get into those elder years where healthcare gets more costly, you can use that health savings account later.
Yes.
And you can use it for the care that you need at that time.
So how has technology changed, obviously, or how is it changing in the consumer's eyes and in the healthcare eyes?
Well, so it depends on what you think about technology, or it depends on like how you define technology. I think that there are some really big challenges in healthcare. One is HIPAA compliance, which is really important.
Which is scary, but it is important.
It is important, but at the same time, it really causes healthcare companies to be a little further back on
privacy.
Well, because they have to be so regulated and so private, it really is setting them back from delivering, I think, more innovative technologies as it relates to sort of things that are on the internet. So like
Yeah.
digital care.
Right.
It's hard to log in to my account
Right.
as an example. So I even think of that as I think of these journeys that members take, I
Right.
consider them sort of journeys, moments. I think of them as, little sub journeys.
Yep.
The journey of logging in should not be hard.
No, but
It
you
should
still
not
have
be
to
hard.
get those files and you have to get them from one place to another. But at the same time, those are still files of a patient. You don't want them to be leaked everywhere, right?
You don't want them to be
No.
leaked, absolutely not. And at the same time, so then how can we still
hand
make it
deliver 'em
easier?
somewhere, yes.
Right. Do we have to hand deliver them? I mean, that
Yeah.
right. That
Let
is.
me send them through the
that is
file
the question.
downstairs just to
Right.
make sure they get there. Yeah.
But I will say that there are some really amazing technologies that are delivering a better experience. So take a doctor, for example. So I've been talking a lot about the patient experience or the
Yes.
consumer
Yeah.
experience. Doctors are high stress.
Yeah.
They can be very burned out. And
The whole
and there's
staff can be. Yeah.
the whole staff and
Overworked.
and I think delivering a better provider experience and helping the provider to do their job better will reduce that burnout. Here's one real important example. Doctors often have to stay late. They don't get paid for that, but they have to document and
Make their
take
rounds.
notes and do all of the things that for the patients that they've already seen.
Yep.
And often you'll find doctors. This is me having talked to doctors.
Right.
Doctors will say, "I'm here talking with a patient, and I'm not even looking at that patient.
Right.
I'm typing, taking notes for that patient, and at the same time, I have in the back of my head the last patient that I saw,
Right.
and trying to remember what I need to document for that patient."
Yep.
So great technology that is happening today. And we need to get patient approval on this.
Yeah.
Every time they ask for patient approval, but it's ambient listening in stereo,
Right.
where if you're the doctor and I'm the patient, we're having a conversation and it is documenting everything that is being talked about in that exam room. And then it will also turn it into CPT codes and put it into the electronic medical record. It is amazing.
Just trying to record and listen and do everything at once and then go to the next room and then, okay, that was important, but I don't remember.
But I don't remember. And
Yes.
it gets rid of all of that.
Yep.
And it allows then the doctor and the patient to be able to look each other in the eye.
Yep.
Which is something, when it comes to trust and empathy, doctors are trained to do that.
Yeah.
They're trained to do something that they're physically not really able to do at
Right.
this point, but with ambient listening now they're able to do that.
Amazing.
And I think that that's pretty cool.
Yeah.
I think another really important one is what's called remote patient monitoring. And there's lots of ways that you can think about doing
Yes.
this. One company that I think is really interesting is a company in which it's just a simple mat, and somebody stands on the mat every single day while they brush their teeth. That's what they like to say. Just spend time brushing your teeth, and within 30 seconds, it will identify the prevalence of foot ulcers 5 weeks before those foot ulcers actually rupture. So this company's goal is to prevent diabetic foot amputations altogether, which, by the way, is extremely expensive.
Yeah.
So talk about lowering the cost of care.
Right.
And also it is it has a 50% mortality rate. Once somebody has a foot amputation, they're more sedentary.
Yes.
And within a year, 50% of people who have these foot amputations actually pass away. And so by creating this technology that will identify the prevalence of these foot ulcers, get the patient in touch with the doctor,
Yep.
so that they can do other treatment besides
Prior to having it. Yep.
prior to having it amputated. It is a huge cost savings.
Right.
So very, very cool technology. Everything from the internet,
Yes.
which we still have challenges,
Right.
right?
Oh, obviously,
all the
yes.
way to ambient listening,
Yep.
and remote patient monitoring.
Yeah.
There's some really, really cool technology.
And there's so much out there that we don't even know about or that's coming that is out there. I mean, from research to everything else, it's amazing to see the way it's going and how much is out there and what's to come. But yes.
Yeah, and I'm probably just scratching the surface.
Right, yes.
But these are some pretty amazing things.
So who have been some of your main or big mentors along the way that have gotten you to where you are today from wherever you are in life?
Wow. Well, Karissa, I think there's something that I'd like to share.
Yes.
And that is something that's really important, that's been an important part of my life, and something you and I talked about recently.
Yeah.
When I was only 10 days old, I was adopted.
Yeah.
And my birth mother made a really, really difficult decision and went away and had me as a child and then left and went on and lived a life and I was adopted by two amazing parents. So to answer your question on
Yes.
mentors in my
Absolutely.
life, certainly the mentors in my life are the parents who raised me.
Yep.
And then I was able to give back to them as well, as I cared for them during their later years. My dad was a professor his whole life, worked in the university systems all across the nation at
Amazing.
UVA and Michigan State and University of Michigan. And he was at the University of Arkansas when they got the call that I was available.
So you're a Razorback fan.
No, I spent no time, and I was born in Denton, Texas, and they drove down from Little Rock to pick me up and brought me back. But I think when I was 2, I was moved to Minnesota,
All right.
and so I've really lived most of my life in Minnesota.
Wonderful.
But my parents, and watching their example and how they raised me. And by the way, I'm the youngest of 3 adopted kids.
Wonderful.
So they never had kids of their own, but they raised 3 very, very different children. We all came from different walks of life and different circumstances, but they were pretty amazing in my life.
Very blessed.
From a career standpoint, I've had wonderful mentors along the way. I think one that comes to mind is a leader that I recently had, probably 15 years ago, who really taught me everything about moving from a small company where I was a big fish in a little pond. I was the president of a loyalty marketing company to a very little fish in a very, very big pond.
Yes.
In healthcare.
For sure.
And so I've still today learn a lot from that mentor.
Yeah. And you like to do some mentoring yourself, Paul. Tell everybody a little bit about the mentoring that you like to do and help out. Yeah.
Sure. Yeah. Well, so I've been asked to be a mentor at Bethel College, which is right here in the Twin Cities, and I'm just starting my journey around being a mentor for a college student. I've been a mentor for in the corporate environment for a number of people, but I would say if I were to, if you were to ask me, for any advice, I would say be a mentor.
Yes.
It is such an amazing.
Absolutely.
I think I get more out of it. I hope.
Yes.
I hope they get a lot out of it.
I get a lot out of it when I do it myself too.
Do you?
Yes.
And so
Yes.
tell me a little bit about who do you mentor, or what's your mentor experience
I've
like?
mentored quite a few people. I mean, I think right now I'm mentoring 2 or 3 people myself. I love mentoring. Whether it's mentoring people in my field, just people in general, young, old, whatever it may be, just giving back, helping out people. I think I learn more about myself and I learn more about other people. It's ingenuine, but it's being intentional. I think it's a lifelong journey.
So for you, is this is this a mentorship as part of a program, or
Not always.
It's just
Sometimes
because
it's just because.
it's just because you just be like, I'm going to mentor that person, and maybe you won't even tell them that you're mentoring them, right?
Sometimes, but sometimes there are programs too where they're like, "Hey, we're looking for mentors," and I'm like, "I'll take a couple. Whatever you need, let me help out." Yes.
Yeah.
Sometimes people will reach out to me and be like, "Hey, I have a couple people or one person or a couple people that'll be a great fit that really want help with, leadership, or want help with business development, or want help getting out there and learning how to network, or want help with this or that. Could you help? And I'm like, absolutely. Let me help. How many days a week, or how many days a month, or what do you need? Yes. But a lot of times it's just taking them under my wing without even them knowing.
Yeah,
Yes.
exactly.
Yeah.
Exactly. And and sometimes I would say, and I'm curious your thoughts on this. Sometimes it doesn't always work out.
No.
Right?
Correct.
Yeah.
Yes.
And I think that's okay, but I think it's important to sort of just call that out, right?
Yes.
So,
Yep.
I remember one mentee, the person liked, they were a foodie, and so they wanted to talk a lot about food. And I said, great, if you want to talk about food. And most of our mentor meetings were at restaurants, and that person liked to talk about food a lot. There wasn't probably a lot of
Learning and growing.
mentoring around like career development or anything like that.
Yeah.
And so you sort of chalk it up and you say, well, that's just
Kind of more of
what
a
it's
friendship
like.
or whatever it may be.
Yeah, maybe. Yeah. But at the same time, I think the pros definitely outweigh the cons
Yes.
in mentoring. And I think you just sort of got to like step out. I have a colleague of mine. We're in a networking group together. And I recently went to a purpose-fueled, there's a purpose-fueled meeting. I'm
Yes.
sorry if I'm getting the name wrong.
Purpose-driven or something. I don't
Purpose-driven
remember. Yeah.
something,
Yeah.
but he was a meeting and he was presenting, and his whole idea was just show up,
Yep.
right?
No
And
matter what, just say show
sometimes
up.
it's going to work, sometimes it's not going to work, but just show up, because you never actually know
No.
what will happen. And that's sort of kind of how I live my life a little
Yes.
bit, is just showing up.
Yep. And if you say you're going to do something, do it. I think that's important too.
I feel like you took the words out of my mouth. You're
Yes.
right. I think, your reputation and your brand is all about building trust
Yes.
and integrity. And sometimes that might look, your brand might look like, oh, I trust that you're not going to do the right thing. What I want to live by is that people trust that my yes is yes and my no is no.
Correct.
Sometimes I'm not going to be able to do things because it's simply the fact that I just don't have the time because
You
I'm
get
doing
pulled a
some other
little too
things.
thin.
I'm
Yes.
going to get
Yeah.
pulled too thin. So it takes integrity to say no,
Correct.
but always do what you say you're going to do.
Yes.
I completely agree.
I agree. And I think for me, I was raised when you're 15 minutes early, you're still late. So, being early is in prompt, courteous, professional. Being early, that's kind of one of those things you stand by and you do, and you say if you're going to do it, you do it. But when you're there, you show up, you be intentional. You show up ready to be there, put the phone down, you listen.
Yeah.
And when you're there, you be there. Don't just show up to show up. You
Yeah.
want to have those conversations. You want to be that person. You want to be there for people too.
That's right.
What have been some important moments in your life that have really changed you?
Well, I already talked about my adoption.
Yes.
And that was, again, a very important moment in my life. Although I just
Life-changing
didn't really, wasn't aware of it. I would say 15 years ago. Well, let me tell you a little bit about my mom. I talked a little bit about my dad,
Yeah.
but I'll talk a little bit about my mom for a second. Do you remember when Ancestry was kind of a thing?
Yes.
This was before Ancestry.com.
Yes. Yep.
But this was more around, like where parents or
Family trees
family
and all that
trees,
stuff.
yes. And
Yep.
I think Ancestry was actually, Ancestry.com was where you would log in and you would like
Yeah, but you had the family trees. Your parents were writing out the trees and trying to figure out
Yes.
who the grandparents and who the great-grandparents were, and you actually had the books and all that stuff.
That's exactly
Yes.
right.
Yeah.
So, well, my family's unique in that way because we're all three adopted children. And
Yes.
so we don't have family trees.
Right.
So my mom decided, well, you know what? The gift that I want to give you is I'm going to try and find your lineage
Yes.
for all three of
Amazing.
us. So she reached out to the different adoption agencies to try and get as much as she could get. And I got documents, and they were documents around, they were redacted. And I learned a little bit about my birth mom and my birth dad. Said things like they have good teeth. Which I don't know why they would say something like that.
What is that going to do for me, right?
That's
yes,
right.
great.
That's right. But,
I got my teeth
liked
from
music.
Your mom, like, amazing.
Okay.
Yes,
Good
right.
to know.
Yep.
Good to know. But my mom kept sleuthing, and she found a name.
Ooh,
and I sat on it for a while. In fact, there were times that I just,
do I want to know this? Do I not want to know
exactly.
this? Am I going to dig? Am I not going to dig?
Yeah, and I'm a big believer. This is just a personal thing for me. I'm a big believer that when a birth mom or dad gives a child up for adoption, they sort of lose the right a little bit. Now, there's a lot of new laws that call for open adoptions and things like that. For me, I felt like that separation was important because I was being raised now in this new home, and I didn't want confusion.
Correct.
Of course, I'm, at the time, at this point, was probably 30 years old, 29 years old, and my mom had found this name. And so I did. I sat on it.
That's huge.
It was very huge, and it was very sacrificial if you think about it, right? And she said, "Here, I'm going to give you this name." And I sat on it. I didn't do anything with it for a number of years. And then one day, I typed that name into Facebook, and it's a unique name.
Yes, so you knew if you were finding it, you would probably find it.
And it just came right up, and I immediately texted my wife, and she immediately called me, and she said, "Wow, what are we gonna do?"
Yeah.
And so we spent a lot of time thinking and praying on how are we gonna approach this? Like, should I reach out to this person? Should I not reach out to this person? And we went through every scenario. What if this person doesn't want to talk to me?
Right.
Will they feel rejected? What if this person is overbearing?
Right.
Will I be okay with that? Right?
How will the adoption mom feel? Just kind of a little bit of everything.
How will
will
the person who has raised me for the last number of years feel? And we went through every scenario, and we again talked and prayed about it, and really what it came down to is I'm going to reach out. So I reached out through Messenger. I did not friend the person.
Nope, just one simple message. Yeah.
But I did say I think we know each other, and that turned into it's the end of the story is it's turned into a beautiful, beautiful relationship.
Oh, wow.
And so as I've said goodbye to the parents who've raised me, I've also earned an entirely new family that has been a huge blessing throughout. My birth mom printed out the dialogue that we had through Messenger in 8-point font, and it was over 80 pages of correspondence back and forth before we ever picked up the phone to talk to each other. And so we have that as an archive, which is really a blessing. But for all it's worth, my children call her grandmother.
Yes.
They called her husband granddad, and they have uncles and nephews and aunts and everything on that side.
Yes.
It's wonderful, and we take family trips together, and so I've gained a new mom later on in my life. That's been a huge blessing. So I give back.
Yes.
That's been a big, as I've already talked about, it's been a big blessing in my life, and so I give back through the gift of adoption.
Amazing.
And that's an organization that I've recently joined the board of, and we raise money to give children, mainly in vulnerable circumstances, give them their forever home. Amazing. And it's amazing too, Karissa, because just $5,000 will give the child the chance for their forever home. It's really not a huge investment, but it's a big, big need for children.
Which is, a lot of people don't think of, but that is enough. I mean, that's enough to set them up for what they need, what they don't have, and to give them the next opportunity.
That's right.
Because there are a lot of foster places out there where kids will go from home to home just trying to figure out where they fit in, what they have, when adoption could be the right fit.
That's right.
Yes.
Yeah.
What do you think is the best advice that you've ever been given?
Well, I like my friend who said just show up. I think
Yes,
that's
that
a
was
good
a great one.
Yeah,
Yes.
that is
yeah,
a good
that
one.
kind of covered
Yeah.
that one. Yes. Yeah.
And I just along the theme of like, do what you say you're going to do.
Yeah.
I want to just add, serve others. That's the best advice
Yes.
that I've gotten. The idea of spending your time giving back to people, giving over to people without anything expected in return,
Yes.
is really the thing that I think
Right.
is the best advice that I can give. I was once asked just recently, what is one thing that you would, what's one piece of advice that you would give your younger
Your
self?
younger self, yes.
And that piece of advice, I barely flinched on it. That piece of advice for me was treat every interaction as the opportunity to build a relationship.
Right.
And I wish that I would have known that when I was a lot younger.
Yeah.
Because I think, just you and me, like I reached out to you.
Yeah.
You reached back out to me and said, "Hey, we should talk."
Yeah.
And now we've developed a relationship, right?
Absolutely.
I think that is a piece of advice that I would like to give my younger self, but also like to give your audience, is treat every single interaction as the opportunity to build a long-term relationship.
Absolutely. Because you never know. I mean, kind of like what we do here, you never know what anybody's story is or what they're battling or what they're going through. So if you can just be that person to listen to their story, or just be a person to put a hand on their shoulder and just say, "Hey, I'm here," or to open a door, or just to be that person to care.
Yeah.
Whether it's maybe you don't need me right now, but just know I'm here to show up, or just to say good morning, or to be that person, because sometimes people just need that.
Yeah.
Yes.
So you probably answered this on probably multiple podcasts, but what's one piece of advice that you live by?
I think to not only treat people the way you want to be treated, but I think the best one is to treat people with respect.
Yeah. Yeah. I think that's hand in glove,
Yeah,
right? Treat them
obviously.
with respect, and live by the golden rule.
Yeah. Yeah.
One book that changed my life, other than the Bible,
Yeah.
is what's called The Ultimate Question 2.0. This is actually something where I decided, after reading this book, I'm going to sell my business and go start to focus more on consumer experience.
Yep.
And that book, The Ultimate Question 2.0, that question, by the way, I won't bury the lead,
Yeah.
is how likely would you be to recommend a company
Yes.
or a person or a product
Yeah.
to a friend, a family member, or a colleague? It's written by a gentleman named Fred Reichheld, who is also a mentor of mine. That's the golden rule, right? Is when I walk out of a meeting, if I work for a company, are people going to recommend me? Are they going to recommend my company? Are they going to recommend my product? And why they would or would not recommend is the way that they're treated.
Right.
It really comes down to the way that they're treated. So I've spent the last 15 years trying to operationalize the golden rule.
Right.
Operationalize treating others the way that you would want to be treated.
Correct.
And so if there's anybody out there that's interested in learning more about operationalizing the golden rule,
Yes.
And understanding how people can recommend or not recommend you,
Yes.
I'm happy to talk more about that.
What have been some of the processes that you've put into place that have been some obstacles that you've kind of overcome?
Processes that have been put into place in
that you've put into place
Oh, that I've
that
been
you've
put.
put into place that have been obstacles that you've kind of overcome, that have been difficult, that have been, well, let me reframe. What have been processes that you've put into place that have been really difficult that you're like, gosh, that took a really long time, but I'm glad I've done it?
Oh,
Sorry.
no,
That
great,
was,
great
yeah.
question. So if you don't mind, I'll talk about healthcare again.
Yes, please do.
One thing that it's sort of a whole system around a government mandated program called STARS, and it's really important.
Yeah.
I actually believe that STARS is one of the best programs that has led to a lot of changes in the healthcare system, and it focuses on those four things that I talked about: outcomes, getting members access to care, getting lowering the cost of care, and delivering a better experience.
Yes.
And they actually weight it more on experience.
Yep.
So talking about getting people the outcomes that they need.
Correct.
I asked advocates at the company that I worked for. Advocates are the people who answer the phones.
Yes,
right?
absolutely.
When you call, I asked them, "Hey, what would you think about helping the people who call get their preventative exams scheduled?"
Correct.
The advocates, at the time they were called agents. They
Yeah.
weren't even called advocates. So they didn't really have the mentality of being an advocate.
Right.
They said, well, that's not my job. But I found like a couple of people to say, okay, I'll try this.
Yes.
And so
It's difficult when people say that's not my job.
it's not my job, right? And
Absolutely. Let's do this. Yes.
and to get a few to just say, okay, I'm willing to try it. I'm going to get out of my comfort zone. And of course, there's many processes behind that to even try to do that.
Right.
But they would put the member on hold. They would call the doctor's office. They would bring the member back onto the phone, and they would help to schedule that appointment with that doctor's office so they
Right.
could get their mammogram or their colonoscopy.
Yep.
And there were, I think, 2 advocates that did it the first month, and we might have gotten like 15 appointments scheduled. It was barely anything.
Yep.
The next month, there were maybe 4 advocates that were willing to try
Minuscule,
it.
but trying it,
Very
yes.
minuscule, and it was just this like slog. And then there were 20, and then there were 50, and we started to just sort of gain momentum around
Right.
this, right? And we would get like 100 appointments scheduled that month, and 300 the next month, or whatever it was. And then one member sent a letter, and that letter said, Denise helped me get my mammogram. I would have never scheduled the appointment. I found out I have cancer,
Boom.
and we got it in time, and I'm going to be okay. And we realized that the thing that we were doing was actually saving people's lives.
It's helping. Making a difference.
And so processes, very hard.
Yes. But make a difference.
Changing the mindset, very, very hard.
Yes. Amazing.
The impact was huge.
Yes. Super amazing. What do you think, like after everything that you've done, you've worked in the airplane industry, you've worked in healthcare. What do you think's next for Paul?
Ooh.
What would you like to be next? Or what do you think,
Yeah.
big picture,
I'm not done in healthcare.
right?
I still want to change the mindset of organizations to put the consumer at the very center of everything they do, whether it's the product design, the product implementation, what's called the last mile of service. I'm sure you're very, very familiar with the last mile of
Yes.
service.
Explain to our viewers if they're not familiar of it.
Well, the
what
last
it
mile
Yes.
is sort of like what ultimately ends up happening on the stage,
Right.
It's
Yeah.
that thing that, like, at the end of the day, I walked into the theater and somebody was in my seat.
Right.
Well,
Yep.
then
Well,
we
I'm
missed
sorry,
out
but
on the
yes.
last mile,
Yep.
right? And so those last miles they can come in a lot of different shapes
Right.
and examples, but it is that delivering the thing that you promised to deliver all the way through. You can do
Yes.
all of this thing leading up to that thing, but if you don't ultimately get that appointment scheduled, as an example,
Yes.
that's the last mile.
Yep.
So I'm still a big believer in putting that consumer at the center, creating those journeys that end up being, my hope is delightful, and I believe that healthcare is still a place that needs a lot of help, and
Yeah.
that's where I want to be focused.
Do you think that AI with healthcare is going to start taking jobs away, or do you think that having that human connection will still integrate and be implementable in the healthcare world?
I don't think that AI
I
is
don't
going to
think
be
so either.
taking
No.
away
People
jobs.
worry about that, and
Yes.
that's frightful for a lot of people, thinking,
Yeah.
hey, my job's going to be taken away. But human connection and having that human world, I mean, even in the medical world, having robots clean floors, you still have to have that human connection, and you still have to be able to work those robots.
That's exactly right. And we talked a little bit about the ambient listening, right?
Yes.
Well, it is changing jobs, so they don't hospitals or health systems no longer have to hire coders that basically take the notes and
Yeah.
try to transcribe and understand them. They don't need to do that anymore. So it's just like the internet, Karissa, right? Like,
Yeah.
remember we thought that everybody was, our jobs
The
were going
world's
to be
going to be
taken.
ending. We're going to have, nobody to type on a typewriter anymore. Well, guess what? People have to run the computers.
They still do. They still do. So there's some really great examples of where I've implemented AI initiatives that still require that human in the loop.
Right.
Advocates are a great example,
Yes.
right? That human connection is so important. So if I call a call center, and yes, we still call call centers,
Yes, right.
but if I call a call center, that advocate needs to be there to really care for that person who's on the other end of the line. Now, they can use AI
Right.
to go get the information and bring it back more quickly.
Yep.
And I think that's one example of where I have implemented an AI solution to make the calls shorter, which is great because it lowers cost, right?
Yep.
But there's still that person on the other end of the line is still having that
The
human
patient's
connection.
care still needs to be taken care of.
That's
Yes.
exactly right. Yeah.
Yep.
So I think it will speed things up, which I think is great. And just like we've had other things that have created, faster technology.
Well, it's working smarter and working for the needs of the patient.
That's right.
Right. At
That's
the
right.
end all goal, right?
Yeah.
And helping their health and their well-being.
That's
get
right.
there, yes.
It's ruining I will say it's ruining inefficiency.
Yes.
And that's my hope.
Which is good. You want the effectiveness to be there.
That's
Yes.
right. Yeah. I've been thinking a lot about something that I've coined as the chauffeur paradox. And the chauffeur paradox is, if you think about chauffeurs in the early 1900s or late 1800s, the chauffeur was originally probably a stable hand. They were the ones that took care of the animals, took care of the carriages,
Yep.
the horse and
Horse and
carriages,
carriages,
and they would
Make the loops.
and make the loops and bring the manor owners around, right? Well, the manor owners are the ones who afforded the
Right.
vehicles, and so when vehicles were first created and there were engines, they needed somebody to drive them. So they could afford them, but they didn't know how to drive them.
Right.
So that's what the chauffeurs were for. Well, chauffeurs actually ended up being a really big nuisance.
Yes.
Because they were the people who had the control of the vehicles in all aspects. They knew how to drive them. They knew how to maintain them. They knew where to store them. And they used that superpower for not necessarily good
Right. The
things.
control.
Right. But when technology made it happen so that the cost of the vehicles went down and everybody could afford a vehicle and
less
everybody learned how to drive, the chauffeur became more obsolete.
Yep.
And they turned into mechanics, and we all remember maybe the more kind of older or the point of view around mechanics. I think of Vacation when I think about that.
Yes,
Like
right.
when they needed new tires,
Yeah.
right? but like, they turned into mechanics, and then they also, turned into what was probably the, 20th century auto dealer.
Yes.
Which also didn't have the greatest reputation.
Correct.
Right. Now, I think that's changed. I think auto dealers
Yes.
are, really amazing business people, and they really try to deliver a great consumer experience. But that took time. And we've gone through these chauffeur paradoxes in so many different ways. We've gone through them with photography.
Yep.
We've gone through them with computers, where only a few people knew how to develop film, or only a few people knew how to run computers.
Pen and paper, handwriting.
That's
everything.
all they knew. Or even telephones,
Yes,
right? So I
right.
needed somebody in the middle to actually make a phone call, right? And that person had all the information,
Yep.
right? Those operators
Telephones
did.
are going away even, yes.
Right. And now with technology and how technology lowers costs and make things simpler,
Yep.
those are the things that will ultimately cause healthcare to shift.
Yep.
Because I do think that we are on the precipice of being required to lower our healthcare.
Right.
We're on the precipice of needing to make the U.S. healthier.
Right.
And so I think the chauffeur paradox and that veil between the consumer and the healthcare companies is being lifted, and we'll make it a better overall society.
What do you think about healthcare costs and people trying to shop around for what's out there versus what's regulated and not regulated, and trying different things?
I think it's okay. I like. I don't know why you can't get acupuncture, and have your health insurance pay for it.
Right.
Right. I don't know why you can't do alternative types of medicines or types of care, and not allow the insurance to pay for it. Now, I think with this new sort of kind of health plan and a health savings account,
Yep.
if you can use health savings accounts for acupuncture, I think that's a step in the right direction.
Yep.
I'm using acupuncture as one example.
Right.
But I think that that in order to allow people to take ownership of their health, you need to allow people to take ownership of their health.
If they want to try something and something is going to work for them, then it might work for them. It
That's
might not
right.
work for everybody, but it might work for them.
That's right.
Yep.
Yep.
Not to say that going out on the street and trying something that's not regulated is going to work, but yes, right. Yeah.
Yeah. I mean, yeah, obviously there needs to be guardrails, but
Right.
but I do think that we need to, maybe expand a little bit of what
I mean, if stem cells
what's available.
is out there, their acupuncture or something,
That's correct.
some medically regulated option is available. Yes.
That's right.
Yeah.
Yeah.
I think I agree with that 100%. I mean, there are lots of options that are out there that are and have worked for lots of people that should be an option. Yes.
Yeah.
So you have worked in a lot of different fields, and there are a lot of different viewers that are out there and that are looking for options and in the medical world, and we hope that you can find something that you're looking for, and we want to help. So how can people get a hold of you?
Oh, they can find me on LinkedIn.
Yes.
Paul N. Long. And I'm there, and
Yes.
I'm actually pretty active on LinkedIn as well. So happy to get into a conversation with you.
And last important question, what's your favorite food?
My favorite
Yes,
food.
a fun question, right?
So my wife just made this bean soup that was absolutely delicious. So I
Amazing.
think that is my favorite food
Staple
right
food
now.
right now, yes.
In fact, since I just mentioned it, I guess I'll have to put it on LinkedIn. And
There you go. We'll share that recipe. We're going to be having that on there. Yes.
Yeah.
Well, thank you so much for being on, Paul, and we wish you the best. And for all our viewers, let us know if we need anything. And thanks for shining light.
Thank